A 24-year-old bodybuilder, six-pack abs, massive chest, perfect Instagram physique. He collapses mid-workout. Not from exhaustion, not from dehydration, from a heart attack. Autopsy shows severe coronary artery disease. His heart wall was 20 millimeters thick. He had been using anabolic steroids. This is not a movie. This has been documented in medical conferences, including the 119th French Congress of Urology, where Dr. Charlotte Methorst presented cases of young men under 30 dying from massive heart attacks linked to steroid misuse. Today we are uncovering the truth about anabolic steroids, what they really do, why people use them, their benefits, their doses, their damage, and whether the muscle dream is worth the price. Stay until the end, because what you learn today could save someone's heart or their life. What are anabolic steroids? Anabolic androgenic steroids, also called AS, are synthetic versions of testosterone. Testosterone is the primary male hormone. It builds muscle, deepens the voice, increases bone strength, boosts libido. Anabolic means muscle building. Androgenic means masculine effects. Scientists originally created these drugs for medical use. They bind to androgen receptors in muscle, bone, heart, testes, brain, and they increase protein synthesis inside cells. That's how muscles grow. But here's the important truth. At medical doses, they are medicines. At bodybuilding doses, they become dangerous drugs. Medical use. When steroids are safe. Let's be clear, steroids are not evil. At physiologic doses, testosterone replacement therapy is generally safe when prescribed and monitored. Medical uses include primary hypogonadism, testicles don't produce enough testosterone. Secondary hypogonadism, brain does not signal properly. Certain resistant anemias, severe muscle wasting, delayed puberty in selected cases. Therapeutic doses usually range 50, 100 mg per week. Depending on formulation, doctors monitor hematocrit, hypertension, lipid profile, benefits at proper doses, improved mood, better bone density, increased muscle mass, better sexual function, improved quality of life. Contraindications include active prostate cancer, breast cancer, untreated sleep, apnea, polycythemia, men planning fertility. So medically supervised testosterone is not the same as gym steroids. The danger begins when doses become supraphysiologic. The gym culture and supraphysiologic doses. In the gym world, doses reach 10 to 50 times normal physiologic levels. Some pyramid cycles reach 1,000 mg per week. That's 10, 20 times therapeutic dosing. And it's rarely just testosterone. Commonly stacked compounds include nandrolone, trenbolone, stanozolol, drostanolone, boldenone. Users follow cycles for 6 to 12 weeks on, then off. Stacking is use of multiple steroids at once. Pyramiding is gradual increase then taper. Many buy from black market sources. No sterility guarantee, no purity guarantee. Sometimes veterinary drugs, sometimes contaminated products. In North America alone, more than 3 million users. Lifetime prevalence, 10% of men, 4% of women, up to 16% in female bodybuilders. Social media pressure, six-pack obsession, unrealistic physique expectations. The culture has shifted from elite bodybuilding to everyday gym members. Next is increased protein synthesis, the core mechanism. Muscle growth depends on one equation. Muscle protein synthesis minus muscle protein breakdown. If synthesis increases then breakdown, muscle grows. Steroids dramatically increase protein synthesis. They also reduce protein breakdown by lowering cortisol activity, reducing inflammatory muscle damage, improving nitrogen retention. Nitrogen is essential for amino acids. More nitrogen retention circs more muscle tissue preserved. That's why steroid users recover faster. Next is satellite cells and muscle memory. Muscles contain dormant repair cells called satellite cells. Normally, when you train hard, satellite cells activate to repair muscle damage. Steroids greatly enhance satellite cell activation. These cells fuse with muscle fibers and donate nuclei. More nuclei means greater capacity for protein production. This is extremely important, because even after stopping steroids, those extra nuclei may remain. This could partially explain long-term muscle advantage in some users. Increased red blood cells. Anabolic steroids also stimulate erythropoiesis, the production of red blood cells. More red blood cells means more oxygen delivery. More oxygen means better endurance and recovery. However, too many red blood cells increase blood viscosity, which increases hypertension, clot risk, heart strain. What helps performance can also increase heart attack risk. Neurological strength effects. Steroids don't only affect muscle size, they also affect the nervous system. High testosterone increases motor neuron firing, neuromuscular efficiency, aggression and drive. This allows heavier lifting. Heavier lifting causes greater mechanical tension. Mechanical tension is the strongest stimulus for hypertrophy, so steroids indirectly amplify training intensity. 8. The dose-response relationship. Scientific studies show a clear pattern. Higher testosterone leads to greater muscle mass gains. Even without training, supraphysiologic testosterone increases lean body mass. But with resistance training, the gains are dramatically amplified. That's why steroids are so tempting. The results are real. The transformation is fast. 9. Bulking versus cutting. How different steroids work during bulking phases. High-calorie diet and heavy lifting, often with testosterone, nandrolone, or boldenone. Goal is maximum muscle gain. During cutting phases, calorie restriction and cardio, often with trenbolone or stanozolol. Goal is preserve muscle while reducing fat. Some steroids also reduce water retention, increase vascularity, harden muscle appearance. This creates the dramatic stage-ready look, why natural muscle growth is slower. Naturally, the body tightly regulates testosterone. It prevents extreme hormonal levels to protect the heart, the brain, fertility, the liver. Steroids override this safety system. They push the body beyond its evolutionary design. That's why muscle grows faster. But systems elsewhere begin to break down. The trade-off. The same mechanisms that build muscle also thicken heart muscle, alter cholesterol, suppress natural testosterone, shrink testes, disrupt brain chemistry. The anabolic effect does not stay limited to biceps. It affects every androgen-sensitive tissue in the body, including heart muscle, prostate, brain, blood vessels, liver. Muscle growth is not selective. It comes with systemic consequence. The heart, the silent damage. This is the most dangerous effect. Prolonged high-dose AS causes concentric left ventricular hypertrophy. Normal heart wall thickness is less than 11 mm. In steroid users is 15 to 20 mm. But unlike athlete's heart, this hypertrophy includes fibrosis. Fibrosis makes the heart stiff. It impairs diastolic filling. It causes diastolic dysfunction. Over time, it leads to heart failure. Arrhythmias occur because fibrosis creates abnormal electrical pathways. Result is ventricular arrhythmias, ventricular fibrillation, sudden cardiac death. More than 60% develop severe hypertension. Lipids become catastrophic. LDL above 200 mg/dL. HDL below 20 mg/dL. This accelerates atherosclerosis. Risk of heart attack increases 4 to 6 times. Cases of 25-year-olds with massive coronary thrombosis have been reported. Young muscular dead. Liver damage. Oral anabolic steroids are especially toxic to the liver. Complications include intrahepatic cholestasis, peliosis hepatis, hepatic adenomas, rare liver rupture. Peliosis hepatis can cause internal bleeding. Black market steroids increase risk of hepatitis B, hepatitis C, HIV, through contaminated needles. Kidney damage. Kidneys suffer through severe hypertension, direct glomerular toxicity, dehydration from extreme training, rhabdomyolysis. Long-term users may develop focal segmental glomerulosclerosis, chronic kidney disease, some require dialysis, fertility, the hidden cost. This is devastating and often ignored. High-dose steroids suppress hypothalamic, pituitary, gonadal axis, and LH drop to near zero. Testes shrink. Testicular weight may fall to 6 grams. Azoospermia is common. Recovery of sperm production may take 18 to 36 months. 10–20% never fully recover. Some men require FSH injections 150 to 225 IU 3 times weekly. HCG dose is 1500 to 2500 IU 2 to 3 times weekly. Exogenous testosterone cannot be used in this phase, it worsens suppression. Studies show long-term users have fewer children. Imagine building muscle but losing fatherhood. Brain and mental health. Steroid use changes the brain. Alters serotonin pathways, dopamine pathways, causes aggression, emotional instability, impulsive violence, severe depression during withdrawal, suicidal thoughts. Muscle dysmorphia develops. Despite huge muscles, they feel small. Addiction pattern, loss of control. Dose escalation. Withdrawal symptoms, relapse. Stopping abruptly causes crash in testosterone. Fatigue. Depression. Anhedonia. Psychiatric support is often required. Sexual dysfunction. Ironically, many develop erectile dysfunction. Mechanisms, vascular damage, dyslipidemia, hypertension, receptor desensitization, psychological distortion. Some do not respond to PD-5 inhibitors. Libido becomes dysregulated. Muscle grows. Masculinity shrinks. Clinical management is, doctors must, not judge, not shame, not threaten. Instead, evaluate hormones level, check assess lipids. Cardiac imaging, psychiatric support. Treatment depends on goal to restore spermatogenesis, maintain hormonal balance, manage cardiac damage. Some damage may be irreversible. Edward was 27. Fitness influencer. Stacked 4 compounds. Within 3 years he has hypertension. 0 sperm count. Depression. It took 2 years of therapy to partially recover fertility. His heart? Still abnormal. His Instagram page? Gone. Is it ever worth it? The promise: fast muscle, extreme strength, rapid transformation. The reality: heart failure risk, stroke risk, infertility, psychiatric collapse, liver injury, kidney failure, all for temporary muscle. Natural training may be slower, but it protects longevity. Muscles are visible. Damage is invisible. The heart does not care about your biceps. The kidneys do not care about your six-pack. The brain does not care about your competition trophy. If you're considering steroids, pause. Research. Talk to a doctor. If you're already using, seek medical supervision. Do not stop abruptly. Get evaluated. Your body is not disposable. If this video opened your eyes, share it. You might save a friend. Comment below. Do you think social media is pushing dangerous body standards? Subscribe for more evidence-based health documentaries. Because real strength is protecting your health.